Okay, as I said a minute ago, good afternoon, everybody. Welcome to our webinar today. This is Building Resilient Communities, Leveraging Recovery-Friendly Workplace Concepts to Address Social Determinants of Health and Combat the Opioid Crisis in West Virginia. I'm Jason Lucas. I'm the Director of Education at CEG, and I'm pleased to introduce our moderator, Rollie Martinson. Rollie is a Senior Policy Associate at CEG, leading the Appalachian Opioid Remediation Project. His expertise and dedication to public health have driven impactful strategies to address the opioid crisis in the region. With a deep understanding of policy development and community engagement, particularly in the areas of substance use disorder and public health, Rollie is the ideal person to guide today's discussion. And we're really excited to have him lead this conversation as we explore innovative approaches to building stronger, healthier workforces and communities. So with that, I'll turn it over to Rollie.
All right, thank you, Jason. Yep, good afternoon. My name is Rollie Martinson. Pronouns are he, him. And I'm really excited to guide you today through today's discussion. As we look at recovery-friendly workplaces and second chance hiring, I want to acknowledge there's a very clear link between the health outcomes of individuals with substance use disorders and their employment status. Employment's not just a job, it's a social determinant of health, affecting everything from mental well-being to physical health. Given that, the purpose of today's session is to focus on the benefits that hiring can bring to employers, looking at a diverse, committed workforce, improved retention, and a positive impact on company cultures and our communities. So as we move forward, we'll start out with introducing our panelists, have a discussion through a few different concepts and definitions. And we'll also share some practical resources and tools that you can use to adopt these practices in your organization. And then at the end, we will save about 10 minutes to wrap up with the Q&A session. If you have questions, you can go ahead and start putting them in, and Jason will help curate those for when we finish. So starting, if each of you could we'll start with Rachel. Rachel, if you could just tell us who you are, what you do, and why you're here today.
Yeah, absolutely. Hi, everybody. My name is Rachel Kaplan. I am not on camera today because my entire family is sick and I look it as well as feel it. But I am here from South Carolina. I am a consultant working with the South Carolina Office of Rural Health. We are working on a 3-year grant project through the Appalachian Regional Commission's Investments Supporting Partnerships in Recovery Ecosystems Initiative. The acronym is INSPIRE. And so we are working on a 3-year grant that focuses on recovery-friendly workplaces in 3 of our rural South Carolina counties. So in Cherokee, Union, and Pickens County.
Thank you, Rachel. It's interesting that you are working on the ARC Inspire grant. So CEG, we also have efforts supported by that grant. And this webinar is actually part of that. We're working to train and have community health workers in about 100 local businesses is our goal in various counties in West Virginia.
That's really cool.
Now we'll shift to Bailey and TAK.
So my name's Bailey and I've got TAK in the room with me. We work at Evis Data with Katrina Gamble as well, who's on. The name of the company is Evis Daido. We do timing drive systems for combustion engines, which is just a fancy way of saying gas-powered vehicles. TAK is the HR manager. Katrina is the VP of HR for North America, so she gets to deal with all of our fun facilities across North America. And I'm the generalist here, and each of us just have a passion for making sure that our facility and community is set up to support people trying to get a second chance at employment here.
Thank you. And Katrina.
Hello. Thank you, Bailey. That was a wonderful introduction. I'm also off camera because I'm also sick. I apologize for that. But as Bailey said, I'm the VP of HR for Evis North America. We're German family owned and ran business that's 115 years old. Uh, I had the Western Kentucky and state of Kentucky's Chamber of Commerce reach out to me about this fair chance, second chance employment whenever they started the program and the initiative. I have a history in working with individuals from this population before I entered into HR, so it was a passion project of mine, as well as Bailey and Tia's. So this has been a very exciting, enlightening, and inspiring program that we've been a part of. So thank you for having us today.
All right, I really appreciate you all being here. So I think we'll start out with some definitions. So I put together some like general definitions, and I'd be curious to see if like it tracks with how you kind of conceptualize these things. So second chance employment, also here called sometimes fair chance employment. So these are hiring practices that intentionally provide opportunities to individuals with criminal records or those in recovery from a substance use disorder, giving them a chance to re-enter the workforce and to really build their lives. Another related concept, and maybe you all could help me connect these two, is recovery-friendly workplaces. So this is where a workplace is proactively supporting employees through inclusive policies and access to resources. So not only providing a second chance, but also promoting the ongoing success and well-being of employees. So maybe we'll start, Rachel. Rachel, how does this definition sound to you? Is that pretty accurate, or are we missing some nuances there you'd like to help fill us in?
I would say that the definitions are accurate. I know here in South Carolina, we just facilitated some focus groups in all 3 of our participating counties with business leaders and employers, and they kind of used those terms interchangeably. And I know that we do have some programs in South Carolina that focuses on individuals who are leaving the justice system and looking for employment, and it's almost like a trial work period where they also work with like a support service organization who provides them with that acclimation back into their community. And so in that sense, I would say that that truly is second chance employment. But I think for employers who haven't really done this work, or they are being more inclusive in their employment policies, but they don't have a term for it, but they've been kind of doing it, that they find these 2 terms to be interchangeable. But that's just my 2 cents, and that might just be a thing that just I'm noticing, or that's just being noticed with the individuals that we're talking to. I know it's so nuanced.
Thank you, Rachel. Bailey, TK, what are your thoughts on that? Do you see them in your work mostly used interchangeably within company cultures, or?
Yeah, I would say they are kind of interchangeable. We've been saying, I guess, fair chance more than anything, but the recovery is less the one that I've been practiced in and heard here as much.
Thank you. And Meghan?
So I would think that if an employer has never, done this before, or maybe they are entering it in, recovery friendly is going to be maybe seen or viewed more geared towards those that are in recovery from substance use disorder, versus second chance or fair chance employment. I've seen in my 4 years of working with First Choice that term is more geared to those that just have maybe criminal backgrounds, or they are coming out of incarceration and they are looking to be implemented back into the workforce. But I have to agree with Rachel that I think that if you've been doing this for a while, that you can see how the 2 terms can really be, interchangeable and mean the same thing. And I'll say, I appreciate the fair chance employment sort of phrase, because for a long time, we have, as an agency, utilized the term second chance. But as we know, sometimes there's third and fourth and fifth and sixth chances. So we have slowly started to change into fair chance employment. So we're not, kind of boxing people or us in to that phrase or that policy, if you will. So
Thanks. I appreciate that nuance. So fair chance, what I'm kind of is a little bit broader, focused more on the fairness aspect and equitable hiring practices.
Raleigh, can I just make one comment?
Absolutely.
When Megan, when you were talking, that really kind of resonated. And I agree with you that the terms are used interchangeably. And I'm kind of wondering if it's because of the stigma about people with substance use disorder. Because even if they haven't been, convicted of a crime, I think that it's still seen as a criminal act. And so that's why I'm wondering if for some people who don't understand the nuances or don't understand harm reduction, or that it's substance use disorder, and it's seen as a disability, that maybe they're still attributing that to whether they say it or not, like this is a illegal act, so you're doing illegal things and you're a criminal, and these terms are interchangeable. We didn't see a lot of overt stigma in that way in our business focus groups, but there was definitely stigma and some implicit bias. And so I'm wondering if that's just one of those things that has been so ingrained in the way people think that it impacts the terminology that's used.
that's fair. Yeah. And also I think the terminology, if you think about it in regards to bias, you could have a workforce that, maybe they are a little bit more lax or friendly to those that maybe have substance use or have gone through active addiction, and are in long-term recovery, but maybe they had a criminal record and they're like, nope, no, you can't have a criminal record. So, I think it's important for people to realize that while, I think it kind of depends on the situation, and as education goes, like those terms could very well mean two very different things or very much the same thing. And I think I'm probably jumping ahead, but that'll tie into your company culture. Like, are you accepting of those who were in active addiction and could, suffer a relapse, and then, not as supportive as those that have a criminal background? Because if you've been doing this long enough, you know that sometimes those two things go hand in hand. And so it's this is an interesting sort of discussion that you started off with, Rollie. I appreciate it.
I think you all know it almost goes without saying that substance use disorders they're often misunderstood, heavily stigmatized. We say it's a medical condition, but then that stigma it can manifest in the workplace too, whether they're they consider themselves to be in recovery, or they may have like a past drug related offense. Maybe they didn't have any type of problematic substance use. Regardless of their current state or qualifications.
Hey, Raleigh, this is Katrina. Can I speak to that real quick as well?
Yes, please.
In our area, in rural Western Kentucky, 99% of the time, an individual that has a substance abuse disorder doesn't enter the system until they have been convicted of a crime. And we don't have the resources available to individuals who might have this disability for them to receive the help prior to actual conviction and incarceration. So we do go with more of the fair chance employment because honestly, we just don't have a lot of people who are in pure recovery. 99% of the individuals that come to us are coming to us out of the system, simply because we just don't have the resources here readily available to these individuals. And we do have in this area a huge influx of methamphetamine abuse, heroin abuse, opioids, things like that. So there's a huge population here of individuals who just don't have that resource that they need. So that's another reason why we utilize the term fair chance employment more than second chance, And we honestly, we just don't have a lot of individuals in recovery. And Bailey, you're doing the majority of the recruiting. So if you've seen something different while I've been traveling North America, then please, by all means, correct me. But that's just our situation and scenario here.
Yeah, I would say that's all true. If they've gone through, just some substance abuse disorders, they're likely coming to us after being incarcerated and leaving their long-term recovery program to be able to re-enter the workforce. So it's very far and few between where they're coming to us without the felony or misdemeanor or whatever criminal conviction that they've had in the past, unfortunately.
And this brings to mind, I don't want to get too in the weeds with definitions, but I think language and words are important for framing this conversation. How do you all see workplaces and the programs, maybe specifically you're working with, think about recovery? There's a few different ways to think about it. If one is like through a medical lens, right? Like remission of a substance use disorder, maybe sustained remission of a substance use disorder. SAMHSA has moved towards a broader definition in the last decade, where they're looking at a process of change and overall health and wellness, not necessarily the cessation or reduction in substance use. And then you also have more like the harm reduction kind of Dan Biggs concept of any positive change. So improvements as defined and directed by the individual. How do you all see that kind of play out in terms of the workplaces that you work with and the programs that you're involved in?
I'm sorry, can you say that one more time so I can process your question?
Yeah, so I was thinking, Rachel, like there's different definitions of recovery, right? One would be like medical, like you had a substance use disorder, now that's in remission, sustained remission. Then like thinking about broader definitions like SAMHSA's or a harm reduction definition, where it's looking at improvement and well-being, not necessarily like a cessation of substance use. So I guess what I'm getting at is do you see workplaces, or how can workplaces look at closer like to the SAMHSA definition of improvements and well-being and stuff, or do you think workplaces see it mostly as in like cessation of substances and like maybe urine results, like, or urine screening results, that kind of thing?
Okay. Because when you started asking the question, I went off on a thought and then I didn't like rein myself back in to hear the rest. So what's interesting is that during our focus groups, so the way that they were structured is that there were 3 focus groups, and instead of these same people sitting at the same tables and being asked 3 different questions, they had to switch it up. So they started at one table and then they would mix it up and go to another table after 15 minutes and were asked, 3 different questions to talk about as a group. And so you didn't get the same group dynamic every time because it was different participants. But one of the things that came up in almost every group for every question is that they didn't really understand what we were talking about when we said recovery friendly workplaces, because to them, they don't understand what recovery is. And so what we found is that there's a lot of misconception that a person in recovery, to them, they still think of that being a person who is actively using. And so we had a couple business leaders who would say, well, somebody in recovery might not do well in our agency, but someone who's recovered will. And so there's this misconception that if you're in recovery, quote unquote, in recovery, that you're still using a substance or misusing a substance, or, like that there's this inability to control your life and the things around you. And being in recovery can mean so many different things for different people. And so that's one of the conversations that we kept having and one of the themes that kept coming up. I do know that businesses were uncomfortable with the idea of hiring somebody who was still actively using a substance, unless it was like MAT type of support service. But there were a couple of like hiring agencies that were there. And they're some of the organizations that collaborate with the jails and the justice, the justice system piece. And so they have a program where they take people who are just re-entering from being incarcerated. And so they don't expect their employees, recovery can mean whatever that means to them. So they're kind of the go-between that checks in on the employee who's being, if that's making sense, like they're the point of contact. And so when employers are looking for work, it's on a like temp basis sometimes. And so when these employees are going in who are in recovery, they're not having to do any kind of drug testing or anything through that company. But the temp organization sometimes is still doing the drug testing, but they're not looking for necessarily an absence of substances. They're just looking for any kind of positive change. So if somebody tested positive in a, in a urine test or in a drug test, 1 week, then the next week they would hope that the percentage of substance would be lower. So they're just looking for any kind of positive movement forward for somebody. But I think without that in between to kind of be that point of contact and take that role, I think organizations are uncomfortable with the idea of somebody being in their point of recovery where there is no substance use and there is no like active temptation. Does that make sense?
That does, absolutely. Thank you,
Okay.
Rachel.
Yeah.
Can I add to this? I should probably wait for the answer if I can add to it or not before I just jump in.
Go ahead. Yeah.
So, from an HR standpoint, I completely agree, because one of the things that and kind of off topic a little bit, but one of the things that we saw during COVID was that HR professionals had to then turn into medical professionals. Is this person ringing a fever? Who have they been in contact with? Blah, 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 blah. That's not what our scope is. And so when you have candidates that come in and they have that urine screen, and then you're supposed to do another urine screen, and then you'd have to build out these parameters, and then it would have to be legal and all of this stuff. So I agree with the fact that employers will be uncomfortable. HR professionals will be uncomfortable with that side of it. I also think that it ties into your policies as far as what recovery means to them. We're a firm believer in MAT. And so when people come in and they are on MAT, we don't even know unless they disclose it, because the screening facility doesn't tell us. And so I think it ties into, what your policies are and your current workforce. So if you are hiring heavily within the recovery community, from what I've seen, and you have somebody that is currently on a substance, and maybe they are misusing it, or maybe they are coming in and it appears that they're under the influence, that might trigger sort of a domino effect with your current workforce. And so then you're also tied in by the parameters, like we're grant funded, so we have to follow federal guidelines. And so there's not any sort of wiggle room for us. But I think that you have to kind of take that into consideration as to what is your current workforce, what is your industry, and what is it going to do for company culture and morale. If that's the understanding and people know that and there's resources available, then that's great. That they are able to do that. And again, I think Rachel kind of hit it on the head. Like, you have to have that middle, that third party person that is making that designation for you, if you're going to do sort of that, sliding scale, if you will. So.
Thank you, Megan. And I'd like to come back to you a little bit later to maybe go into some more details about some of the legal considerations and compliance issues that employers may face. So let's shift now and looking at the business benefits of second chance hiring. So I'd be curious to see like real world examples, like what benefits have you seen from places that have implemented second chance hiring? And then also, so two-part question, what benefits have you seen in businesses who are taking these steps? And then the second part, are there like examples of like any kind of financial incentives, tax credits, any kind of like programs that really, you know, incentivize businesses to take these steps to be able to tap into this section of the workforce? And we'll start with Rachel.
Okay, yeah, I can't really speak to the incentive piece because a lot of the businesses that we talked to, I wouldn't say that they necessarily fit 100% the definition of being a recovery-friendly workplace or like a second chance employer, but they're implementing a lot of pieces that get them towards that goal. And so some of the benefits that employers talked about in these focus groups for them is that they are finding people who, if it's a job where you need very specific training or you need to be trained based on the protocol of that organization, they find that it's easier to get somebody who doesn't necessarily have the experience in that field or with that plant or with that company, but that is just looking for employment, if that makes sense. And so they're finding that there are a lot of members of this demographic that they're looking for a job, whether they've been incarcerated before or not, and they're trying different avenues, different types of jobs, trying to get out of maybe some of the what's the word I'm looking for? Some of the industries that they've been in before that have not worked for them, or maybe they're trying to move from a job to a career, if that makes sense. And so we found with like with big companies like Michelin, for example, that's just a big company in South Carolina, that because they have such specific training protocols, that pulling people in from this demographic and training them has been much easier and much better because they're not trying to combat training that they've received somewhere else and change the way that they've been doing something. So that's just it's a benefit that doesn't necessarily have to be just from pulling in from an undervalued workforce. But that is one of the benefits that they talk about, is finding people and being able to train them the way that they want them to do the job that's very specific to their protocol. And that's just the one thing that jumps into my head when you ask that question.
Thank you, Rachel. Megan?
So I have found that a lot of the benefits is, I don't even know where to start. There's so many of them. So I have found that the employees that we have that are from that population, they are accountable. They will tell on themselves before you can even find out that they have done something wrong from an HR standpoint. They're reliable. And there is a shared camaraderie there in the group that they just work well together. And it has done so much for the overall like feeling within our workforce. It has made it a happier place. It's made it a more comfortable place because people feel like that they can come in and they can be themselves, which is really nice. They don't have to hide this thing that they feel like that they should be ashamed of. And so it reduces that stigma, which is really beneficial, of course. And from my standpoint, recruiting, my biggest recruiting tool is word of mouth, because they all, people that come from the recovery community, mostly, not all of them, but they want to give back to the community. They want to put back in what they have been given. And our organization is one way to do that, because they answer people that are looking to get into treatment. And so, they want to be there, they want to do the work, and then they want to tell their friends about it. They want to tell their friends that are coming out of treatment or coming out of sober living, hey, come work here. And so it's really helped, build a workforce that puts a lot of pride in their work and wants to do a good job. And they hold themselves accountable, and it's, they just do a great job. They do a great job at what they do. And so, and I think too, from somebody who's not in recovery, and who believes that everybody deserves a chance, they're so thankful. They're so thankful for someone to say, absolutely, come and work here. You can do this work. That they work really hard to do a good job because they feel like somebody has finally believed in them. Which is kind of sad because, I'm not in recovery and I believe in everybody. And so, those are just some of the big benefits that I've seen, from my end.
Thanks. I think that's so interesting that you see it like spread out through like company culture at large, right? And I would imagine if we have enough places in a community doing that, we'd also see that throughout the community too. Bailey, TAK?
Yeah, with what Megan was saying, there's so much to talk about with this. But just I hope everybody has been able to have the experience of being able to hire someone that hasn't gotten that chance before, because yeah, the thankfulness and gratitude is never ending. I mean, like years later, we're still getting like, thank you so much for this opportunity. Like, I've just never been able to get a chance like this. And that's not just with their employment, that's their housing, that's wherever they go. To see that hope in their eyes, like return for just getting their employment in place, to be able to get everything else in place is unmatched. Like she said, it increases their loyalty, their retention within the company. They have really good staying power. They're also kind of our cops of the building. They are very protective over our culture and in their spot at our place here, that if anybody else is acting out, you can't do that before we even have a chance to tell them, because they're like, you're gonna mess this up for us. Like, they're always on everybody else for that accountability portion, because they're like, they really understand the value of our place here, and to follow those policies is just something that we got to do. And again, it just really expands the candidate pool, especially where we're at. A lot of companies aren't taking this opportunity to expand their candidate pool and help out the community. So we are not thankful for that. We wish everybody would, but we are able to get a significantly higher amount of candidates in place. And for us in this area, the members of this demographic that I've seen come through are actually the ones that we kind of need the most, the skilled trades. So it's been very helpful for us for that, just to get them started back into their career, because the skilled trades are very difficult for us to find. So we're very thankful for that. And yeah, just for me personally, I'm proud to be a part of a company that allows this, especially in a community that might not value it as much as I think it really should be, because this is our community, it's our people, it's our responsibility, and we all have a part to play in that. So I'm definitely proud that we're taking this opportunity to be able to help with that and advocate for them.
Perfect.
This is Katrina, just to kind of expand on what Bailey said. And I don't know if anyone picked up on that, but she mentioned housing. Again, we don't have a whole lot of individuals coming through that are just simply in recovery. The majority of our individuals are coming out of incarceration. And Bailey has physically gone with individuals from this demographic to apply for housing, to vouch for them. She's helped individuals get, and Tia as well, get a car loan for someone who hasn't been able to buy a car in 10 plus years. This demographic is a group of individuals who do need a little bit of extra support, simply because a lot of them, they don't have photo IDs. They don't know where their social security cards are. They don't know where their birth certificates are located. They don't know how to get them. And the support that we've been able to give to this demographic, we've got employees for life. And another thing that we're very mindful of is again, we're manufacturing and assembly, but where do we actually place these individuals? What jobs are going to work best for them to be a benefit to our company? And it's not just that skilled trade group, but are they going to be able to stand on an assembly line and do the same thing day in and day out? Are they going to be okay in a crowd of people? Are they going to be better off in the back and where there's only one or two others that they work with and they're not as in the spotlight? It's really making sure that we're putting the right person in the right position, and educating the rest of our employees on, we actually don't use the term recovery. We don't use the term, this is a fair chance employee. This is an employee. This is a human, just like you. They're equal, just like you. And they're not going to tell you their story unless they choose to. So it's really being mindful of their personal privacy, their needs, and understanding that they're going to need a little bit of extra support. But once you give that to them, they're at work every day. They're positive. As Bailey said, they're the police. I feel 100% safe with any one of the three of us in that building with these people there. They really make sure that our company and the individuals who've been there for them that we're okay. They step in and say, hey, how are you today? Are you good? Thank you. So those are all things to think about. They are oftentimes our sunshine on a cloudy day.
So I'm hearing from all of you some amazing benefits, right? Like so many sectors in our country, and especially in the Appalachia region, are facing labor shortages. So looking at a larger, more diverse talent pool, I'm hearing loyalty and employee retention brought up really, and just the overall positive impact on company culture, community reputation. Given that, let's shift to like what are some of the challenges? Like, what common concerns do you hear about businesses looking at adopting these practices, whether that's like legal considerations? Maybe Megan, I'd be curious for you to start us off with looking at like really like legal challenges and compliance issues. Like,
Sure. So I have found, and I want to be cautious because what I don't want to do is I don't want to tie in, my experience, or how am I saying this? So I don't want to tie in being a recovery friendly workplace with, as the recovery community is the only population that has this struggle. But my biggest challenge from an HR professional, and I'm interested if Bailey and Katrina have seen sort of the same thing. My biggest struggle right now is how to navigate mental health issues that stem from, maybe it is substance use, maybe it's being incarcerated, or maybe it's just because, a wide variety of reasons, but mental health issues and how to navigate those in a legal fashion. And defining terms of, what is self-awareness, what is harassment, what is bullying, what is discrimination. Those are my biggest challenge. And I've always been curious is if it's because of a population that I'm working with, or because it's a generational thing. But it's definitely something that we have to be mindful of, because, people that are in recovery that, have a relapse and things like that, or people that are, incarcerated, they have rights too. And so they deserve the same treatment as I do. They deserve FMLA to go to treatment if they qualify, as if I do, if I'm having a procedure or having a baby. So it's kind of navigating on what is fair and what can we do? What legally can we do to support this person that also doesn't undermine what we're trying to do? There's still a business to run, but I think that you could ask that question. Bailey's shaking her head. I think that you could ask that question for anyone. And so I think the legal considerations are there regardless of who you're hiring. you know, I'm not going to treat somebody's screen differently just because I know ahead of time that they are in recovery. I'm not going to, I don't know. I guess it's just the way that we have developed our work culture and our company policies, that it's just, it's not a factor. But it's one of those things where, you know, you just have to be mindful of how you proceed, just as you would with anyone else. And what can you legally do to support that person and still ensure that your business needs are met. So it is a battle, but I think it's just I don't know that it's within this community specifically. I think it's just an HR battle that we're facing right now. And so I'm interested to see if Bailey has anything to offer.
Yeah, Bailey, I see you nodding on that one. But Megan, so what I'm hearing is maybe like substance
I feel
use
like I
disorder, treat
rambled
it
a
like
bunch, I'm
how they would like any medical condition, right? That it's not its
Mhm.
own separate unique thing, it's a medical condition.
Yeah,
Bailey,
absolutely. So if one of my employees, like we had an employee, for example, who went through training, and everything seemed fine, and she disclosed that she had a relapse. My initial reaction is, okay, we work for Help for West Virginia. Let's get her into treatment. Is she going to agree to go? If she does, there's an agreement that we sign. She went to treatment, she came back. And she's a successful employee. And so it's the same thing that I would do for somebody that fell down the stairs and broke their legs. What can I do to support you? What can I do within the realm of my legal ability to support you that still follows company policy? And it's not, you know, it definitely isn't, I've had a relapse, okay, you're gone. Or, oh, you're high, you're gone. It doesn't, for us, it doesn't work that way necessarily. So I think, but that's my industry. You know, we're not manufacturing. We don't have anybody driving, you know, big trucks and heavy machinery, you know, so we have the ability to do that.
I think Tia and Bailey, this is Katrina, can really speak to this. Tia covers all of our FMLA, all of our health and well-being, and she also covers work comp, and that's a huge thing that we have to think about, you know, when working with specific populations and the legal ramifications. And you know, we are required to drug test if anytime there's a work-related accident or injury, and how we handle that. And so she's probably going to want to murder me right now, but I think that Tia should really speak and give her experiences on this one, if you don't mind, please.
Meghan has said it as well. You're walking a fine line, a tightrope. You've got to make sure that you want to fulfill the needs for the employees, help them through the recovery, help them through the process if they need it, but you're also running a business. You also have to deal with work comp. You also have to deal with FMLA. So, you know, sometimes it comes down to a case-by-case basis as how well you can assure the employee that you're willing to work with them, but be upfront and letting them know there could be some issues legally, specifically with work comp and that. So it's having those conversations and just doing the best you can to navigate through these very legal fields that we work within every single day.
Yeah, absolutely. It's definitely tough. Because I certainly struggle with just, this is a human, so we should be able to do whatever we can to help them, especially if they might not have the current resources to help, and we do, right? But considering the business is definitely needing to be, it's that balance between them both, right? And so that boundary I definitely struggle with, just because we should be able to help everybody through the situation as a community, not just our business. So that's where the three of us, Katrina, Tia, and I, have definitely gone out into the community and gathered what resources we can to provide, whether it's contact, housing, Tia knows everybody here that owns a house or has property. So thankfully she's been able to help people set up and do the phone call ahead of time of, hey, like if you're doing a background check, what's it going to be like? Is this guy wasting his money? Because some of those applications cost $50, $100, which isn't necessarily something that we should be required to do by any means, but that's something that is free for us to do, just to call ahead to make sure. And if they do, just if we can vouch for them, just they've been with our company for this long, you know, and it's such a small community that we're able to say, Tia, trust them. So what are you going to say to that? But just collecting those resources, and for our community being so fresh to this, when those resources aren't available, we have gone out into the community and said, we're disappointed. Like, this should definitely be something that we should have in place and advocate for. And thankfully, we've been making some good strides with that. But just also with all of it, that's been able to help is just a cost comparison. Someone needs a $2,000 loan for their house. That's a drop in the bucket for someone that has to, you know, quit their employment and go back home to where their more dangerous situation was, to be able to retain that employee. So it is case by case, and we're very lucky to have a smaller group to be able to do that. But it is definitely one of the biggest challenges of what's my role in this, the legal side, and just what we're supposed to be doing versus what we actually can do.
Right.
And we've also gone as far as to, again, very rural, very small, reach out to all of the local police departments and sheriff's offices and let them know that we were actually going to start participating in this program. Simply because I was raised by a police officer. They have a stigma. You know, they have their own preconceived notions, and just letting them know, hey, look, you can't, you know, just walk freely into my building. You can't just pull whoever you want off of my production floor. You need to ask first, and you have to follow your legal processes. Simply because this person has a background doesn't mean you get free reign. And they've been very respectful and very receptive to us as well. And quite frankly, our law enforcement agencies are grateful to us for doing this, because it does help drop the recidivism rate. So it's, from a legal side, I even think touching base with your local law enforcement and letting them know, and probation parole offices, and letting them know that you're willing to work with these people, that really does also go a long way, and they can help you navigate the legal piece as well.
Thank you. Rachel, did you have any thoughts?
I can't speak to like the legal piece, but what I thought was interesting in these focus groups is that there are things that business leaders and employers would like to put into practice so that they can become more recovery friendly, but they're things that they don't necessarily know how to do. So there's this desire to do it, but maybe the barrier of not really understanding how to do it legally or how to do it effectively. So for example, one of the really big key categories that was talked about a lot was workplace flexibility and support systems. So this idea of creating flexible work arrangements so that they can offer a flexible schedule to their employees who are in recovery, so that, you know, if they needed to accommodate their schedule to attend, if they go to any kind of like 12-step meeting group or support group, that they would be able to take the time out of their day to go to that group, or to, if it's a remote group, to be able to like call in and participate in that group, and be able to make accommodations the same way that they would for somebody who's a parent who has to maybe leave early to pick up a child from school, or maybe has regular doctor's appointments for a different type of disability. And then this idea of wanting to establish peer support so that there is some kind of support system within the organization, within their peers, and figuring out how to more effectively promote their employee assistance programs, because that is a big benefit to employees. But a lot of times, you know, during the hiring process, and then afterwards during like those meetings, sometimes it's kind of like, hey, here's how you access your EAP, but they're not going through what all of those actual benefits are, and then people aren't taking advantage of them. So it was just these different services and ways that they would like to kind of, I guess, like address and change their workplace culture to be more recovery friendly, but they just don't know how to do it. It's like you have the starting line, you have the finish line, but they don't know how to get from point A to B.
Okay, maybe we can kind of park here for a moment. This webinar is being recorded, and employers will be listening to this. And let's say they say, okay, this sounds good. Where do I start? What do I do? So what would be the first steps to take? Are there any certain resources that you've found like very helpful to implementing like a second chance hiring or creating a recovery supportive workplace?
I mean, I think, and I'll just speak to what I've noticed with both this project and another project with the South Carolina Office of Rural Health, where we were focusing on co-occurring disorders, is that there's just a lack of education. And so if current employees and supervisors and people who are higher up in the organization don't understand what recovery friendly means, what second chance employment means, if they're not addressing their biases about substance use disorder and that it is a disease and not a quote unquote immoral choice. So I think that there needs to be internal staff trainings on this topic so that a lot of that implicit bias and stigma is being addressed right from the beginning. Because then when you have somebody come in, their peers as coworkers are going to be more open and willing to work with people that are different from them. Their supervisors are going to be more understanding and more flexible. And then people who are making decisions from a much higher up level are going to understand how their thought processes and their decisions impact the people below them, where their decision may not impact them personally, but it trickles down to everybody else in the organization.
I 100% agree. This is Katrina. I was going to say the first thing that we did was develop our process and our policy before we even went any further with the project. And then it was presented to our executive leadership. And once we had their buy-in, it was the middle management, and then it was the supervision staff. And we even went as far as to offer educational pieces on this demographic to our just generalized workforce. But getting their buy-in and their support was the first thing that we had to do in order for this to be successful. Simply because, again, these people are human, living human lives. People are people-y, as I like to say, and we have to support them as best we can. And also working with our supervisors to find out which ones were the most open to it, and really focusing on those individuals. And we started with that particular supervisor group, and once it was successful with them, filtering it out through the rest of the facility. But really making sure that we were educating, that we had all of our ducks in a row and a very concrete policy before we even ever started, and being very specific with where we placed people in the beginning, in order for them to be able to be their best self and their most successful. To do it. And Bailey and Tia, you can speak to anything that I may have missed.
Yeah, I really don't have anything to add. I think education, even for the people that are like, oh, I've been through it before, I've already had the training on this. You learn something new every time. You find out a new stigma that you might hold yourself, a new lens that you see through. And I think it's vital just to make sure that that education piece is there, because often all the concerns are relieved right then and there. To the safety portion, the workforce portion, all the other stigmas that come with it. Definitely getting that out of the way first so that it's a successful start for everybody.
And I think I won't take up too much time because I know that we're getting close to it, but I agree that the training and the policy development is crucial. It's like one of the first steps. And then you hire the people that are willing to believe in that mission, in that culture. we do not bring in a director, a coordinator, or anyone in our agency that does not agree to not necessarily align, but definitely not tolerate. They have to be willing to accept that we are that work population. It is ingrained in literally everything that we do as an agency, from advertising positions to hiring, interviewing, recruiting. And so it's build out that policy and then figure out a way to intermingle it in everything that you do. Because that's how you get the right people in the right positions that believe in that culture and that mission. And then it's a no-brainer. Like, it just trickles down and it's just ingrained into everything that happens in the agency.
Thank you. We're running close to being out of time. Does anyone have anything they want to share? Any closing thoughts? Anything I didn't bring up today that I should have?
I just
Seeing
want to say that
someone,
sorry, you can go ahead.
I'm sorry too. Seeing someone who has never been given an opportunity in their entire life, a grown up, in, you know, their all the way up to their mid to late 40s, being excited as a child at Christmas over simply getting a job and being accepted. That's why we go into HR, in my opinion. Being able to help individuals who would not have necessarily been able to receive that type of help, watching them grow, watching their success, and watching them trickle that down through the rest of their population in the community. It's very rewarding and very worth it.
Thank you, Katrina. I can't think of a better way to close out today's session. I want to thank all our panelists today. Your experiences, your thoughts, really made this a really meaningful conversation. And it's from this, I think it's clear that embracing second chance hiring, it not only supports the individual, but also strengthening the companies and tapping into what I'm hearing is a very dedicated workforce. So let's all continue to think about how these strategies can impact our organizations. And I thank you all for your time today.